Let's see an NCLEX RN video on emergency, trauma and environmental injuries. The nurse is caring for a number of patients who have arrived to the emergency department following an explosion at a local food treatment plant. Which of the following orders should the nurse implement first? Administer 5 mg of oxycodone to a patient with a deformed ankle. Administer an albuterol nebulizer to a patient with difficulty breathing due to inhalation of debris. Assess orthostatic vital signs on a patient who is experiencing dizziness. Apply a wound dressing to a patient with a laceration to the forearm. All these are important, but remember ABCs. Airway and breathing come first. So here, administer an albuterol nebulizer to a patient with difficulty breathing due to inhalation of debris. The nurse has just received a report on assigned patients. Which of the following patients should be assessed first? Patient A with an admission diagnosis of snake bite to the left forearm who has been treated with anti-venom 24 hours ago. Patient B who just arrived to the unit with an admission diagnosis of allergic reaction and tongue swelling recently complained of hoarseness. Patient C who was admitted with a spider bite has been treated with antibiotics and is ready to be discharged. Patient D who was admitted yesterday with heat exhaustion and has recent stable vitals. Patient B is at risk for respiratory compromise due to the allergic reaction. Allergic reactions are sudden onset and require a prompt response. So here patient B. The nurse is caring for a family that was admitted to the emergency department following a car accident. The car was traveling at 40 miles an hour and was stuck on the driver's front side. Which of the following family members should receive immediate attention? The 40-year-old female driver who is having difficulty breathing, the 21-year-old female front seat passenger who is complaining of chest pain, the 16-year-old female who was a rear seat passenger and is complaining of abdominal pain, the 18-year-old male who was a rear seat passenger with a laceration to the right eyebrow. The driver took the main impact of the crash and difficulty breathing is the priority. The patient with chest pain should be assessed next, followed by patient with abdominal pain and then the patient with the facial laceration. Remember ABC, airway and breathing come first. So here the 40-year-old female driver who is having difficulty breathing should get immediate attention. The nurse should monitor for which of the following clinical manifestations in a patient diagnosed with hypothermia: swelling and pain, bradycardia, arrhythmias, alkalosis, altered mental status. The patient with hypothermia has myocardial irritability, bradycardia, metabolic acidosis, and altered mental status due to poor perfusion. So bradycardia, arrhythmias, and altered mental status will be there as a clinical manifestation in a patient diagnosed with hypothermia. There is typically no swelling and pain. Which statement by the patient about snake bites indicate the need for further teaching? So I should return immediately if I develop swelling, redness and an increase in pain. If I have dark or bloody urine, I should seek immediate medical attention. It's okay to pick up a snake right after it died. I should return if I start vomiting or have shortness of breath. So it's not okay to pick up a dead snake. There is a reflexive bite response even after death. So that indicates the need for further teaching. As an emergency nurse in an inner city emergency department, you are responsible for developing a trauma prevention program for your community. Who will be your priority patient population? 10 to 34-year-old African American males, 10 to 34-year-old Caucasian females, 75 plus year olds, 10 to 35-year-old Hispanic males. 10 to 34-year-old African American males are in the age group of having the largest number of death to trauma. Males are having more than twice-fold the injuries and deaths from injury than do females. African Americans have the largest percentage of homicide in the population, and homicide has the highest rate in urban areas. Hispanics have a high percentage of deaths from homicide, but not as high as African Americans. The nurse understands priority pre-hospital interventions include which of the following? Transporting the patient as quickly as possible to the nearest trauma center, treating all injuries found and then transporting the patient, notifying the local hospital of the transport of a trauma patient and transporting the patient quickly, assessing the patient using ABCs, treating life-threatening conditions, then transport to the hospital. A pre-hospital provider's priority is to quickly assess using ABCs and stabilize or treat the life-threatening conditions and quickly transport to the appropriate facility. The appropriate facility most likely is the nearest trauma center. However, if the patient is too unstable, the closest local emergency department may be the most appropriate facility in order to further stabilize the patient, then transport to a trauma center. Pre-hospital providers should not be treating all injuries found, only immediate life-threatening injuries. The nurse caring for a trauma patient understands that which team member will establish priorities for the patient's care and authorize the interventions and procedures. Trauma surgeon, trauma team leader, anesthesiologist, radiologist. The team leader will orchestrate the care of the patient through delegation and supervision of the other providers and staff in the room. The surgeon is responsible for procedures and surgery. The anesthesiologist is responsible for airway management, and the radiologist interprets X-ray. So here it's trauma team leader. The nurse understands the purpose of damage control surgery is in which of the following? Control hemorrhage, prevent renal failure, prevent contamination, avoid further surgery, control hypoxia. Damage control surgery or DCS is done to control bleeding, prevent contamination, and perform temporary wound closure as necessary. The patient is then treated in the ICU to correct the physiologic abnormalities before definitive treatment or surgery. It is done to avoid prolonged procedures which put the patient at risk for hypothermia and the trauma triad of death. Measures to control hypoxia and prevent renal failure are ongoing during the hospitalization, not specifically associated with surgery. Although DCS may positively impact both by avoiding complications associated with prolonged procedures. The purpose of damage control surgery is thus to control hemorrhage, prevent contamination. A 30-year-old female driver who was in a front-end high-speed motor vehicle collision is admitted to the emergency department. She had a seatbelt on, but the car did not have any airbags. There was severe front-end damage with spidering of the windshields in front of the driver's seat and a bent steering wheel. The nurse caring for this patient should anticipate and monitor for which injuries: sternal or rib, T-spine, pelvic fracture injuries, head, cervical spine, sternal or rib, cardiac contusion, hollow abdominal organ injuries, head, C-spine, solid abdominal organ injuries, sternal or rib, collarbone fracture, pelvic fracture, facial fracture injuries. Sternal and rib fractures would be expected due to the force of the impact of the patient's body had with the steering wheel. The force was great enough to bend the steering wheel, making there be a very high index of suspicion of a sternal fracture and rib fractures. With such a high force, chest wall injury, a cardiac contusion, must also be suspected, and the patient will need to be monitored for cardiac dysrhythmias. Spidering of the windshield takes great force, and with it being directly in front of the driver's seat, the cause of the spidering is most likely the driver's head, and therefore there should be a high index of suspicion of a head or brain injury. This also puts the patient at greatest risk for C-spine injury due to the deceleration forces. Anytime there is a high force head or brain injury, C-spine injury must be suspected. The patient was wearing a seatbelt in a high force accident. Abdominal organ injuries should be highly suspected due to high force and deceleration forces in coordination with the seatbelt sign. T-spine injuries would potentially happen, but not as high as an index of suspicion as a C-spine. The same is true for pelvic fractures. Due to the seatbelt sign, it is not just solid abdominal organs that are at risk, but also the hollow organs. Facial fractures can happen, but most of the impact is farther up the head and not the nose area. So here, the patient should be anticipated for injuries of head, cervical spine, especially C-spine, sternal or rib injuries, cardiac contusion, hollow abdominal organ injuries. The trauma nurse anticipates which of the following complications when treating an intoxicated homeless patient after he was hit by a car in the snow. The patient is in C-spine immobilization, has an open femur fracture, a pelvic fracture, abdominal tenderness, and a GCS of 12. Decreased hemoglobin and hematocrit, decreased SpO2, tension pneumothorax, sepsis, decreased partial pressure of carbon dioxide. The patient is at huge risk of having a bleeding complication due to having both a femur fracture and also pelvic fracture. Abdominal tenderness indicates potential liver or spleen injury, furthering the risk of bleeding. The patient is homeless and was hit in the snow, placing the patient at a much higher risk for hypothermia, which can cause coagulopathies that increases the bleeding risk further. Both the alcohol and the bleeding can easily cause the patient to vomit, putting the patient at greater risk for aspiration and decreased SpO2. The patient's low GCS score puts the patient at further airway risk, since it is unknown if the GCS is alcohol-induced or secondary to head trauma. Respiratory depression may be present, potentially resulting in an increased PaCO2. Sepsis may be a potential eventual complication for this patient secondary to open femur fracture that allows for a source of infection. There is no mechanism of injury that would indicate a tension pneumothorax. So here, decreased hemoglobin and hematocrit, decreased SpO2, sepsis can occur. The nurse is caring for a patient coming into the ED unconscious after taking an overdose of an unknown substance approximately 1 hour ago. Which of the following actions should the nurse take first? Initiate gastric lavage, insert 2 large bore IVs, assess vital signs with pulse oximetry, insert nasogastric tube. Weak or absent respirations or low oxygen levels require immediate interventions before initiating interventions directed at the overdose. So assess vital signs with pulse oximetry. The nurse should monitor for which clinical manifestation in the patient diagnosed with mild hypothermia. Ataxia, shivering, cardiac dysrhythmias, oliguria, hypoglycemia. Mild hypothermia result in shivering and ataxia. Dysarrhythmias, oliguria and hypoglycemia may occur with more profound hypothermia. The nurse is caring for a patient who came into the ED with a temperature of 105 degree Fahrenheit. The patient was found at home in an apartment without air conditioning. The current heat wave has a temperature above 100 degree Fahrenheit for the last 3 days. Which of the following actions should the nurse plan to take first? Apply cooling blankets, obtain laboratory specimens, establish IV access, administer Tylenol. There should be an emphasis on cooling the patient. The longer the patient remains hyperthermic, the worse the prognosis because of the damage to the patient's organs. Obtaining IV access is important to allow fluid resuscitation, and laboratory analysis will provide a baseline of the patient's condition. Tylenol is not indicated. The nurse is caring for a patient bitten by a rattlesnake 3 hours prior to the admission to the ED. The nurse correlates which of the following clinical manifestation with a venomous snake bite: edema at the site, bleeding at the site, excessive diuresis, dysarrhythmias, numbness at the site. There will be bleeding and edema at the site, not numbness. The patient will not experience dysarrhythmias or diuresis in that time frame. The nurse is caring for a patient who presents 4 hours after a spider bite to the hand. The hand is slightly swollen and there are areas of redness and painful blistering. The nurse correlates these symptoms with which type of spider bite? Brown recluse, black widow, hobo spider, tarantula. The brown recluse carries a hemolytic venom which causes localized skin breakdown and necrosis, and at times more serious hemolytic reactions such as thrombocytopenia or hemolytic anemia. The black widow releases a neurotoxic venom that causes massive presynaptic relapse of neurotransmitters, causing diffuse muscle pain, spasm and rigidity, and extreme stomach pain. The hobo spider bite is characterized by a completely painless initial bite, progressing to painful induration and erythema within 30 minutes, then multiple small blisters within 15 to 35 hours, and then finally progressing to serous exudate encrusting a cratered wound within 72 hours. The tarantula bite feels like a bee sting. The venom is weak and causes redness and swelling. 3 teenagers after a house party at approximately 1 a.m. a vehicle drive by and start shooting at them and at the house. One male is shot in the head, another male is able to run away and call 911, the third is shot in the torso. On the arrival of the emergency medical personnel at the scene, the team finds 2 victims. The first victim is found to be shot in the head and has no vital signs or signs of life. He is declared dead at the scene. The second victim is found to have 2 gunshot wounds. The EMS team quickly stabilizes packages and start to transport the patient to the nearest trauma center. Pre-hospital EMS consultation to the Level 1 Hospital Emergency Department and Trauma Center. 19-year-old male with a gunshot wound to the right shoulder and lower back. Vital signs: heartbeat 120 beats per minute, BP 120/60 mmHg, respiratory rate 24 breaths per minute, pulse oximetry 90% on room air, 98 on 100% non-rebreather mass. GCS 15, IV 18 gauge, left antecubital, ETA 2 minutes. On arrival to the trauma bay, the patient is sitting up and yelling that he cannot breathe. Vital signs: heart rate 130 beats per minute, BP 155 mmHg, respiratory rate 30, SpO2 98% on 100% non-rebreather mask. There is a single gunshot wound to the right shoulder and a single gunshot wound to the right upper quadrant of the abdomen. No other wounds. On assessment, there are minimal breath sounds on the right, positive breath sounds on the left. The trachea is midline. The pre-hospital providers have performed a needle decompression to the right chest to release accumulated air due to a pneumothorax. The 19-year-old gunshot victim is still complaining of shortness of breath. A needle decompression was done in the field to release air because of the pneumothorax, preventing a tension pneumothorax. Initial assessment confirms minimal breath sounds on the right, requiring right-sided chest tube with positive air and blood return in the chest tube. The patient's breathing becomes less shallow and labored. A second IV is placed, laboratory tests are drawn, and warm fluids are hung. Upon further assessment, patient has a wound to the right lower back, which is tended to palpation. Current vital signs: heart rate 135 beats per minute, BP 90-50 mmHg, respiratory rate 22 breaths per minute, oxygen saturation 99% with 100% non-rebreather mask in place, temperature 97.7 degree Fahrenheit. A fast examination is performed and is positive. The operating room is alert and the patient is prepared to go to the operation room stat. In the operating room, the bleeding is controlled. The patient is moved to the ICU where he begins to stabilize. After receiving the report from the field provider about the patient, the trauma nurse anticipates and prepares for which initial interventions: chest tube placement, rapid fluid infuser, open chest massage, intubation, magnetic resonance imaging. The chest tube tray setup is needed for treatment of the hemopneumothorax. The patient is tachycardic, which could be from the low oxygen level. However, the patient's BP has been decreasing and the patient's heart rate continued to become more tachycardic even after the chest tube placement. This sent red flags that there is bleeding going on, and with the second GSW so close to the kidney and liver, which are very vascular, one must worry about the patient exsanguinating from these injuries. Thus, the rapid infuser should be prepared in case it needs to be used quickly. The patient is talking and has no need for intubation or open chest massage. MRI is not indicated in this case. Faster evaluation tools such as fast exam are necessary. So, prepare for chest tube placement, rapid fluid infuser. The nurse recognizes this patient is at risk for developing which complication? Infection, airway compromise, hypovolemia, rhabdomyolysis, seizures. The patient is at risk for hypovolemia and infection due to gunshot wound and airway compromise due to the hemopneumothorax. There is no crush injury or fracture that would put him at risk for rhabdomyolysis. There is no head injury to put him at risk for seizure. What symptoms should prompt a quick intervention from the nurse in this case? Hypertensive, hypothermic, anxious, tachycardic. Hypothermia is implicated in initiating the lethal trauma triad of death. In addition to the trauma surgeon and nurse, what other members of the team are essential at the bedside in the patient's care? Airway provider, radiology, clinical technician, laboratory technician, pharmacist. In a level 1 trauma center, typically all except a laboratory technician is at the bedside or readily available. The laboratory technician is in the lab ready to run tests. Airway provider, radiology, clinical technician, pharmacist. The nurse is responsible for which of the following functions as part of the trauma team? Documentation, medication administration, airway management, Management of rapid fluid infuser central line insertion. The nurse is responsible for all except airway management and central line incision. So these two providers or physicians manage. So here the nurse is responsible for documentation, medication administration, management of rapid fluid infuser. Hope you understood this video. Thank you so much. Please do keep watching.